way that we are that we will be taking questions is through the control panel on the GoToWebinar screen. So hold on one moment. It looks like some folks might not be seeing the slides. Okay. So I'm going to go ahead and introduce our wonderful speakers for our one-on-one webinar series, Rides to Wellness, Creating Healthy Communities. First off, we have Danielle Nelson, who is in charge of the Section 5310 program at the Federal Transit Administration. She's also the program manager for the Rides to Wellness initiative, and that's what she'll be talking to you about today. Also from the FTA, we have Rick Opstelten, who works to promote closer collaboration between federal programs supporting transportation. We have Judy Shanley on the phone with us. She is the Vice President of Education and Youth Transition at Easter Seals, and she's also one of the co-directors of the National Center for Mobility Management, and she will be speaking to you about that. And finally, we have Carolyn Jeskey, who will be available for our question and answer section. She is the Director of Community Engagement at the Community Transportation Association of America, or CTAA, and along with Judy is one of the 3 co-directors for the National Center for Mobility Management. And the contact information for everyone is right there at the bottom of your screen. And if you don't get a chance to write all this down, we will be sending the recording out in a couple of days. With that, I'm going to go ahead and hand it over to Danielle.
Hi, and thank you everyone for tuning in today to be with us to talk about the importance of Rides to Wellness, or as some people say, Wheels to Wellness. I just want to share, Jess, I have not seen on my screen the slides. Is that just for me an issue, or?
Judy, are you seeing the slides?
Yes, I can see them. Must just be me then. Well, I will go ahead and you should be seeing an outline slide, and I just want to quickly tell you all about how FTA, the Federal Transit Administration, supports mobility management. I'll briefly give you an overview of Rides to Wellness, and then I want to help everyone here, if you have not already, connect with your federally supported community health centers and the Aging Services Network. So next slide, what this is a graph that really just shows everyone how the Federal Transit Administration funds have been supporting mobility management over the years, starting from 2006 up until 2013. And for the Section 5310 program, the Enhanced Mobility of Older Adults and those with disabilities, it's the second largest expenditure behind purchasing of buses. On the next slide here, you see the Veterans Transportation Community Living Initiative, and this really is a discretionary program that's helped to invest in one-call, one-click centers across the country that have really helped to get veterans and their families rides, both medical as well as social and other programs in the community. And so the next slide you see here is where the Veterans Transportation and Community Living Initiative grantees are throughout the country. And now, moving to the next slide, I want to tell you about how we're moving. There's been such great success with the Veterans Transportation Community Living Initiative, and now we have just kicked off, as of this year, a new Rides to Wellness initiative. And what this is with the DOT Secretary Fox's support, DOT is really looking to become a partner in the transformation of healthcare. And it's a perfect time now with the Affordable Care Act, as it passed in 2010, is really growing legs in communities, and we're seeing changes. The important thing is that individuals can get to care, and that's where FTA comes in. And the picture you see on the screen is of a bus rapid transit program out of Cleveland, Ohio, called the Health Line. And because of this system, and you can see the map there next to it, individuals in the community are able to visit their doctor, to pharmacies, access healthy foods, fill prescription medications at pharmacies. So it's a wonderful example of how individuals in that community have Rides to Wellness. And so you can see there that the goal of Rides to Wellness is through rides, people in community health thrive. So next slide, please. This one talks about why Rights to Wellness is important. And I'm sure many of you know the statistic that 84% of healthcare costs in the U.S. are spent on managing chronic conditions. And these are things from diabetes to arthritis, heart disease, HIV, and half of all people in the U.S. have at least one chronic condition. And so on average, that's on a yearly basis, about $2.1 trillion is spent on managing those chronic conditions. And so really the goal of Rights to Wellness is to help address the health disparities that exist within these chronic conditions. So for example, using the diabetes example, people of color are disproportionately affected by chronic conditions like diabetes. And so, for example, last year, Native Hawaiians or Pacific Islanders were 15.4% more likely to be diagnosed with diabetes than their white counterparts. And so moving on to the next slide, this is our three-pronged approach about how we will accomplish the Rights to Wellness initiative. And really it's about stimulating investment through community grants, like the one you're going to hear about from the National Center co-director Judy Shanley in a moment. It's also about building commitment, really connecting that health and transportation divide. And we kicked that off with a Rights to Wellness Summit in March, where we had 100 individuals, professionals from the health and transportation silos, in essence, come together to begin this process. And the last three-pronged approach is to really drive change. And we are grateful for the Affordable Care Act because we think that sort of prompted this. And going to the next slide, I was just talking about the Rights to Wellness Executive Summit. This was a wonderful event that happened on March 11th. And if you are not familiar, I really welcome you to use the URL link at the bottom. The National Center for Mobility Management, our wonderful partners there, have posted the videos from that session, and these podcasts are really great. We had the administrator from the HHS Administration from Community Living, Kathy Greenlee, and I think her video is a great one because she actually says in there that at the summit she said she had never said it publicly, but that public transportation issue scares her. But she realized that it's not about having the solutions to transportation, it's about knowing the right people. And so I think that really that summit helped us all realize that bridging that health and transportation divide, we don't have to have all the health answers as transportation providers, nor does the health providers have to have all the answers to transportation. We just need to know the right people and make these connections. So the Rights to Wellness Summit, you're welcome to view that and see the information, including the PowerPoint slides that were presented that day. Next slide. And again, Judy's going to be talking about this in a moment, but I just wanted to mention our wonderful partners at the National Center of Mobility Management are about to release healthcare access challenge grants that are very exciting. Next slide. Last but not least on Rights to Wellness, these are our next steps. I mentioned that it just kicked off this year as of March 11th, so it's a new initiative. And taking all the feedback we heard at the summit, we've created 4 next steps to this initiative. And the first one is to really create joint messaging with our partners on Rights to Wellness. So we really want to ensure that we are having messages that resonate both with healthcare and transportation industries. So we're going to be having a focus group that brings together both to really create those messages. The next is convening the Coordinating Council on Access Mobility to really help the CCAM come together around this issue on Rise to Wellness. Next, we are working on, with the Department of Health and Human Services, on potentially developing a jointly funded grant opportunity similar to the Community Access Healthcare Challenge grants, put on a larger scale. And last but not least, we are looking to bring the research community into this initiative and use them as experts to help us figure out a way to have a pilot project that can be data-driven to really show the importance of that connection between health and transportation. Next slide, I wanted to take an opportunity just to share that we have a new partnership with the Health Resources and Services Administration and some of our other old but wonderful partners, the Administration for Community Living and, of course, the VA. And we're working on looking at how to connect public transit with the community health centers that are federally supported by the Health Resources and Services Administration. So this new partnership, we're looking at, we've been interviewing community health centers as well as aging services professionals and transit professionals to really talk about what connections exist in communities between community health centers and transportation, what's working, where are the gaps, and how can we move forward together. So the next slide talks about some of the costs to missed appointments. So we discovered from talking to several community health centers from across the country that the missed appointment rates in those centers who serve low-income individuals who are either uninsured or underinsured are missing their appointments at rates between 20 and 40%. Most were higher on the 40% rate. And so a lot of community health centers, to recover the costs, are double booking those appointments. And so really there's such a need for transportation, we have been learning. And really the cost of that missed appointment is expensive. And so transportation would be a much more financially feasible option to get them there. And next slide, this really was what we summarized out of these interviews, is that for health centers, transportation is a real issue that has not been figured out. Just wanted to share that. And this next slide shows you where the community health centers are across the country. So each of those dots represent a community health center, and also community health centers provide services such as medical care, behavioral health, and dental care. And if you go to the next slide, this is the way to find your local community health center. HRSA, or the Health Resources and Services Administration, has a Find a Health Center webpage. The URL is listed there. You just type in your zip code and up will pop your local community health centers. There are 1,300 across the country. And so there's also a widget that you see in orange there that you can add to your web pages if you would like to have that for your constituents to be able to find their health center when they visit your web page. And if you go to the next page, here is a missed appointment calculator. Yes.
Danielle, sorry, this is Liz. I'm project manager. We've gotten a couple complaints about not being able to hear you that well. So if you could just speak up a little bit for these last few slides, that would be awesome. Okay, continue.
I'll speak a little bit closer and hope that works better. So on this slide, it's a missed appointment calculator. Is that any better, Jess?
That's
maybe
a little
just
better, I think.
A little louder, yeah.
Yeah,
okay.
You can.
And then, so this missed appointment calculator is a tool that can be helpful for community health centers, accounting for the cost of a missed appointment. And so the next slide here shows the Aging Services Network. So that at the top is the Administration on Aging, which is the federal funder. And then it goes down to the state units on aging, of which there are 56. And then the area agencies on aging and the tribal organizations. And that just goes to show you that 11 million older adults and their caregivers are remaining in the community due to these services. And this slide shows you how to connect with your Aging Services Network. So you visit eldercare.gov, and then you type in your zip code, and up will pop your local area agency on aging and Aging and Disability Resource Center. And just like with the community health centers, there's a widget you can add to your web page to help your local area constituents connect with their Aging Services Network. And now the next slide is for my colleague, Rick Opstelten, so I'm going to pass things over to you, Rick.
All right, thanks very much, Danielle, and thanks everybody on the phone and on the web here. Before I begin in earnest, let me ask, can everybody hear me okay?
Rick, I think you could be a little bit louder.
Let's see if that helps. Any better now?
That's better. Yeah.
Okay, great. So thanks very much, Danielle, again. And what I'll talk about briefly is another aspect, if you will, of the Wrights to Wellness initiative and the charge that we have to promote health and wellness in our communities and among our citizens. And that really comes from the understanding that access to health means also access to food. And Danielle mentioned our executive summit held back in March. We had also in attendance there the administrator of the Food and Nutrition Service at the Department of Agriculture, Ms. Audrey Rowe, and she was there because the Food and Nutrition Service has recognized that they have a challenge in their ability to provide meals for children. So just a bit of background here. The Food and Nutrition Service supports, in the summertime, local meal sites, and there are many thousands of those, across the country where kids who would in the school year be having access to lunch or breakfast at a reduced rate or free in school to allow those same kids to have meals during the summertime as well. The trouble that they've encountered and that they came to FTA with is, they find that kids are unable to safely reach those meal sites. And we heard some really horrific, I would say, stories in our summit and in talking with their office about children having to walk down the sides of highways to reach meal locations. So this is our charge here. This is our challenge, is to try to figure out how we can connect transportation resources, as represented perhaps by many of you on the phone, mobility management practices, and my friends Judy and Carolyn will talk more about the National Center for Mobility Management and their role, and also their activity in this direction. But we want to work together with all of you and with all of our community to figure out what kind of opportunities might exist to help FNS, help these children to access food, to see that the goal that FNS has of serving 200 million meals in the summer of this year, 2015, is met, and to see that this is a vital connection to our whole Rights to Wellness purpose. So if I can move now to the next slide. Right. We have laid out something of a plan for quick and we hope impactful action together with our friends with the Food Nutrition Service. And there are 4 steps essentially to that, which I'm going to briefly sort of talk about. One is to identify success stories. And that really, again, could come from you all, coming from the field and telling us of situations that you've encountered, that you know of, that you perhaps have been involved in, that have resulted in connections being made between transportation resources and the locations and communities that are providing these vital meals to kids in the summer. To educate the stakeholders on both sides of the divide between we and FNS, transportation and food and nutrition services, enabling partnerships, so having a sit down together in local communities and elsewhere at regional levels perhaps, and figuring out, well, how can we work together? How might our resources work together? How might funding work together? How might we simply work locally to resolve this problem? And then to demonstrate success. And so if we can find a couple of good, strong examples of our goal here being reached, can we multiply, replicate, and magnify that onto a larger scale? So I'm going to ask now for my friend Judy with NCMM to take over. She will talk a bit more about our budding partnership on the Summer Meals Program and a great deal of other useful resources and information. So Judy, go ahead.
Terrific. Thank you, Rick. And thank you, RTAP, for inviting NCMM to be part of this discussion. I think that 2 national projects like ours are a good example of how collaboration can happen. As Jess explained, I'm Judy Shanley, and I'm with the National Office of Easter Seals in Chicago, and I oversee our education and youth transition work, and also part of my role is transportation and mobility. And so I'm excited to be a co-director of the National Center for Mobility Management. I share that responsibility with Carolyn Jeskey from the Community Transportation Association, as well as Rich Weaver from the American Public Transportation Association. In the next slide, it was my way of saying thank you to all of you and commending for all of you for taking time out of your busy day and being part of this webinar. This is a comic that I love and I probably overuse. Dennis the Menace is looking up at Mr. Wilson, and he said, "Come on, Mr. Wilson, we can't do any following until you do some leading." And so what I think we hope will emanate from this webinar is that you all become leaders and champions for the work that we're going to discuss. So thank you again for being here. And on the next slide, I talk a little about the learning objectives. I want to give you a context for mobility management. Many of you probably are familiar with the notions, but I want to really put that as a foundation so you're understanding the healthcare challenge work that I'm going to be talking about. I'll talk a little about NCMM and how you can leverage the resources that we have available, and then we'll move into the specific work about the Healthcare Challenge Grant Program. On the next slide, there's a definition of mobility management, and the 3 key tenets of the definition that I think are important, I've highlighted. One, it's customer focus, so it's really driven by customer needs. 2, mobility management seeks to create a network, a coordinated system. And third, it's really based upon the community needs. Doug Burney from the Federal Transit Administration once said that mobility management is a system in place to assure that everybody that needs a ride can get a ride. And that's what we at the National Center really espouse to. On the next slide, I sometimes have to, I don't know whether the word is convince or persuade or really highly encourage people to think about why mobility management makes sense. And for these reasons, it does. We all know that ridership is increasing for a number of reasons, whether people aren't deciding to use their own vehicles, whether the cost of vehicles and insurance is so high that the numbers of people using public transit and fixed route and other modes of transportation are increasing. Secondly, mobility management offers flexibility. Some of us don't take just one mode of transportation, and a mobility management system really seeks to make the various mobility options in community coordinated and cohesive. There's also quality of life issues that really facilitate mobility management making sense. We'll talk about the health initiative, the work that Rick and we are doing around food and nutrition service. It's really about enhancing the quality of life for people. Next is economics. There's more efficiency. It's more feasible sometimes for systems to coordinate and to reduce duplication and kinds of resources. So economically and financially it makes sense. And then finally, customer focus. We all are passionate about our work, whether you're human services, whether you're transit, and the bottom line is we want to provide services that are in line with what our customers need, what the end user needs, what the rider needs, and mobility management with its customer focus really emphasizes that. On the next slide, I graphically depict why mobility management makes sense, and this is a picture of huge congestion on a crowded highway with a bus in the center. Well, you know, that's one of the reasons why mobility management is an important concept. On the next slide, it may be a little difficult to see, but this is a true picture of a community in which there were 3 paratransit or demand response vehicles in front of the same apartment. And one was picking up a veteran, one was picking up a senior, another picking up a person with disability going to a work setting. And, you know, when you look at that, it kind of makes you think if those providers had coordinated and talked about the kinds of needs that those riders had at that residence, that maybe there wouldn't be this duplication. And then on the next slide, we're going to be talking about why it makes sense in terms of facilitating access to health care, access to post-secondary education and college, and importantly, access to jobs in the economy so that all people with disabilities, veterans, older adults can be contributing members of our society. On the next slide, I really want you to think about how you can leverage some of the resources that we're producing through mobility management, the National Center for Mobility Management. I used to work at the U.S. Department of Education, and DOE provided $48 million a year in national technical assistance projects. And when I spoke with educators at the local level and I talked to them about how they were using national resources, many of them didn't even know the resources existed. So I hope that you'll be a leader and you'll be a champion for the resources. Just like RTAP produces amazing resources, we as a National Center produce resources that really our intent is to get them into the hands of people that need the resources. So please leverage our resources. The mission on the next slide of the National Center for Mobility Management is really to help communities build their capacity to implement mobility management, whatever that looks like in your community. There is no one right system. There is not a wrong system. It's the system that works best for your community, your needs, and the people in your community. But our ultimate goal is to empower people so they can live independently and advance health, economic vitality, and self-sufficiency. I'm going to tell you a little about us in the next couple slides. We are, as we said, a National Technical Assistance Center. We're in our second year. We were launched in early 2013, and we represent a partnership. Easter Seals, APTA, APTA, and the American and the Community Transportation Association. And just by nature of our operation of our center, I think we're modeling of what mobility management can look like at the state and local levels, where you've got human service organizations like an organization like Easter Seals working cooperatively with transit associations like APTA and the Community Transportation Association of America. And we thank the Federal Transit Administration, who is our funder at the Department of Transportation. On the next slide, there's some description of our activities, and I hope if I were seeing you face-to-face, I would say, how many of you have used our resources or are signed up to get our newsletter or participate in our LinkedIn page? These are just some of the forums that we provide. We understand that people learn and access information in varying ways, and so we try to customize those ways that we outreach to the field in a diverse way of forums. We provide technical assistance, so we've got national, I'm hearing some feedback, Jess.
Can everybody make sure to mute your line?
We provide national technical assistance through webinars and national trainings that we've got online posted, but we also provide direct technical assistance, for specific issues that folks may have at the local or the state or the regional level, and we've got a toll-free number. The other thing that we're doing is identifying and document promising practices in mobility management, which I'm going to get to in a little bit on the next slide. We have implemented something called a Mobility Management Information and Practices Database, really neat repository of practices. It's descriptions of different strategies that different communities around the country are using to address mobility management. We provide some demographics about the community so you can get a flavor for how that particular strategy is implemented. The information is self-reported by the communities. They've included accompanying documents and tools to help you replicate and consider whether any particular strategy is viable for your community. And it's flexible, and we're continuously updating it. On the next slide, we have one of the major reasons for us implementing this practice database really was because it's so difficult sometimes to sift through information to really find out about mobility management practices and what evidence there is for the practice and how do people know that it works. And so one of our major reasons for setting up the MMIP was to help people easily and efficiently find practices. The next slide, another one of the reasons for establishing the MMIP was because there's a lot of stuff out there, right? There's a lot of content, there's a lot of information, and you sometimes don't know whether it's going to be appropriate or a right fit for your community. And so with the information that we provide in the MMIP, including the context that the strategy is in place, the resources it takes to put in place, the stakeholders involved, hopefully that'll help you make better decisions about whether a particular practice is suited to your own community. And on the next slide, really, it's just our way to respond to the continuous calls that we've gotten for help, help, I'm drowning and I need help. On the next slide, I put our regional contacts, and this is on our website. The way we've organized our technical assistance is, we've got a small staff, and we're stretched, just like probably all of you are, and so we have regional liaisons that are assigned to each of the 10 FTA regions, and you could access the information on the website, but I just wanted to give you a flavor for how we're organized. The next slide has the additional FTA regions. And I put our contact information for Rich, Carolyn, and I on the last slide that really pertains to our project. Call us anytime, and we look forward to having conversations and learning about your work. I put a slide in before I start talking about the healthcare work. This was This comes from a book by Susan Scott, Fierce Conversations. And the quote is, "If you always do what you've always done, you'll always get what you've always got." So I think of mobility management as a really neat opportunity to be creative and innovative and kind of think outside the box. I know that's cliche, but that's what mobility management can offer to us. And on the next slide, the Rights to Wellness program is really an opportunity to do that. You know, we recognize that more and more people are eligible for health care benefits as a result of the ACA, as Danielle explained, and the Rights to Wellness initiative that we have through the Mobility Design Challenge is an opportunity to address that in creative ways. So let me tell you a little about that. We had a competitive grant process, and probably about a month ago, through independent review by external people, identified 12, and it may be that we are identifying more community-level teams to address their challenges associated with healthcare access. It's a 6-month project, and we're providing each grantee with up to $25,000 to support their design challenge and their problem. On the next slide, Danielle referenced the 4 challenge areas that our grantees responded to. 1 had to do with preventive care and primary health care. 2 was ongoing dialysis treatment. 3 related to post-hospitalization medical appointments and rehab and therapies. And the final priority area was behavioral health treatment. So these 4 areas were really pulled out of the literature and data as being probably the most pressing issues facing communities regarding access to health care. And so we asked our grantees to identify one of these areas and then describe how they would address the challenge of that area. So on the next slide, in the applications and in the current grantees, they were asked to select one of the 4 healthcare challenges for their focus, and they also were asked to talk about 2 solutions. You know, in the application process, it was pretty intense, you know, and I don't know if you all saw the application, but it's available on our website. But we asked teams to really think about, you know, what's the foundation for the issue? Why is this challenge occurring? What stakeholders need to be involved? And so based upon that, we asked them to also propose 2 potential solutions that they thought could best address those challenges. And so on the next slide, I talk a little about the phases of the project. So 6 months is not a long time to address this topic, and we're really trying to maximize the time that the teams have to work together. And so the first phase is May to June, and in that first phase, the teams are really kind of learning about each other, learning about the problem and the conditions that may have caused the problem, and really collecting input from the stakeholders and the customers and the people affected by the issue. And it's really strengthening their thinking about what solutions would best address the challenge. And then in the next phase, which is from August through October, they have narrowed the process down to 1 solution that they feel as viable. And the next slide, it really flushes out the steps that we're anticipating that our teams are going to be using in their design challenge process, where they're learning about the solution through conversations with partners. They're getting buy-in. They're looking at other research, maybe national research or even research in the community that comes from other sources. They're providing a business plan or kind of a strategic map for where they want to go with the solution and what kind of resources they need to address that solution. And then the phase will culminate with a pitch. You know, we all have heard of elevator speech or kind of a natural pitch that you use, and that's really the expectation, is that they're going to take all this wealth of information they've collected in both phases of their work and be able to make a pitch. That pitch also may involve initial testing, kind of prototyping with customers to try out the solution and find out if it's viable, find out if there's potential for it to go further. But that kind of gives you the overview of the phases of the work. And in the final slide, what we've learned in this process, and design think is a well-established evidence-based kind of theory or theoretical model for moving toward problem solving, very customer-focused, very driven by the needs of a multitude of stakeholders. But the three, we call this, Danielle had a three-prong approach too when she was talking about kind of the overarching framework for healthcare access. But this really is our three-prong approach to the solutions that people generate through these design challenge grants. One, is it going to be desirable? Is it desirable to all the customers? Is it desirable to patients? Is it desirable to the physicians? Is it desirable to the healthcare professionals that are working in the industry? Feasible. Is it operationally and technically feasible? Do you have the resources to be able to adequately and optimally implement the solution? And then finally, viability. And viability really has to do with the resources, the financial resources, and whether there's efficiencies and whether it results in reduction of costs and increased service and increased quality. So in a nutshell, that was a huge overview of both the National Center for Mobility Management and the Healthcare Challenge grant process, and we're hoping to be able to announce the grantees shortly. But we're very excited to be doing this work, and as I said, this really is an opportunity to be innovative. And what we hope to do is we will have forums available through the NCMM website, so that even though you may not be in part of the grantee, you may not be a grantee or not as close to the challenge grant process, you still can learn from our learning. And we'll have forums, open forums that the field can participate in, and we'll have opportunities to have dialogue on our partnership for mobility management LinkedIn pages. So we want to help build capacity around this work even as we're doing the work, and that'll be really fun. And then I just quickly want to mention that I don't have any slides on it, but Rick mentioned our work with food and nutrition services. We are reaching out to the field to identify, as Rick explained, some examples of what's working. Do you have relationships, if your mobility managers or even your human service or other agencies, a transit agency, are you working with food and nutrition service representatives? Are you working with summer meal programs in your community? What does that look like? What kind of resources does it take? How do you know it's working? And we're hoping as we collect this information, we're going to be building a repository of information and developing a toolkit so that if access to summer meal programs are an issue in your community, you will have available through NCMM a toolkit that you can use and apply in your community. So look forward. I hope you all sign up to get information from NCMM so that you can be apprised as we're producing these materials. And again, Carolyn, Rich, and I love the interaction with the field and love the opportunity to talk with you. So at any time, please feel free to ask us any questions and contact us. So thank you again for RTAP and Jess and Neil for coordinating this, and turn it back over to you, Jess.
Great. I'm actually going to turn it over to Liz to ask some of the questions that you guys have asked during the webinar. And if you are still thinking about a question, go ahead and type it right into that chat box. So Liz?
Thanks, Jess. And yeah, I am the other project manager at National RTAP. And first, I wanted to remind everyone that we have Carolyn Jeskey on the line now for questions. She's the co-director with Judy of NCMM. So Carolyn, just do a quick sound check. Can we hear you okay?
I hope so. Can you hear me? Uh-oh.
There's a little bit of feedback. Are you on the line, or maybe you can connect by phone if you're doing it on your computer? But, well, the first question's for Danielle, so.
I'm ready.
Okay. Why don't we get started with that, and Carolyn, maybe try and call in. Usually the sound is better that way. So we will take some questions that have come in through the webinar, but as Jess said, feel free to type into the questions panel and we'll get to those. So the first question is for Danielle and maybe Rick. According to the HRSA website, there are no community health centers in my area. How are Rights to Wellness addressed for us?
Great question. And so the HRSA-funded community health centers are not the only place to look to partner with healthcare. So in the community, if there are no community health centers around you, another option would be to talk with your hospitals. And so with the Affordable Care Act, hospitals, the readmission rates are being looked at. So hospitals with high readmission rates, they're being financially penalized. So a readmission would be anyone that comes back to the hospital 30 days after a discharge or 90 days. And so hospitals are being incentivized to keep people in the community and keep healthy, and because it's affecting the bottom line. So that's things like working on care transitions. So when you're discharged, they want to help you ensure you have a ride to a follow-up care appointment, or that you're going to be able to get to a pharmacy or get your prescription filled through the mail, etc. So I would definitely suggest reaching out to your local hospital, as well as any community health center. I mean, as Rick mentioned, healthy foods are important. So even partnering to get people to and from healthy food options, there's a vested interest in the health side of the ledger to keep people healthy in the community, and they really need you, the transportation providers, to get people there. And so I've heard of even grocery store chains partnering to bring individuals, such as older adults, for example, to their grocery store to shop, and contracting for that sort of a thing. So I'd be happy to talk with you offline with more suggestions.
Thanks, Danielle. This is another one for you. Where can I find the missed appointment calculator?
So another great question. That is something we are working on right now with HRSA. And so one of the things is it really depends on each location, because they're going to be entering in what they pay for a physician's time. So that changes depending on where you're at. So if you put that in and it includes, for example, it's $20 or $10 per minute of that physician's time, and they allotted a 15-minute appointment that there was a no-show, it's going to change. That's something we've been in discussions with HRSA about, and it's under development. But if you were to Google online, there are some different tools out there that already exist, missed appointment calculators. But as for the one that we're developing, it's not ready for release yet.
Okay, great. And then I'm not sure exactly who this is for, but probably you, Danielle. Is the Northwest region of Washington State eligible?
So the grants that Judy was just talking about, those ones have closed, unfortunately. So the Healthcare Access Challenge grants that at least 12 communities will be awarded here shortly, those ones unfortunately have closed. But as Judy was mentioning, they're quick turnaround, and we're looking at those projects as great examples that we can use when we have an additional grant that's going to hopefully be coming out that will be a joint grant between us, the Federal Transit Administration, and the Health Resources and Services Administration. So we are still working on that, and just bear with us because this is all brand new, a new initiative that's come out. So we're trying to work out sort of with our partners at the federal level a joint grant opportunity, and we will make sure to shout that from the rooftops. So RTAP will ensure to let you know when that grant opportunity does come together. So stay tuned on that.
Okay, great. Next one is kind of for everyone, but maybe we'll start with Judy and Carolyn. What specifically can people do right now to get started with mobility management, and how can people get involved with Rights to Wellness? So what are the next steps? And maybe Judy or Carolyn, if you want to take that on mobility management, kind of the application of the information that you covered today.
Sure. Carolyn, I'll start, and if there's anything you want to contribute, please do. We've got a lot of resources on establishing mobility management programs on our website. I think, obviously joining our listserv and getting updates regarding what we're producing is a good first step. We also, through the Partnership for Mobility Management, which is our LinkedIn network, one of the best ways that people learn is from each other, and so you will be able to identify communities not only through that forum, but the MMIP, as I said, the database that we have, so that you could reach out personally to some peers that maybe you're already doing this work, that whose communities resemble your communities, and you might want to reach out to them and find out what they did and how they did it and how they started. You also can seek the services of your regional liaison, and I'll make sure that that link is specific on the PowerPoints, but find out which of us from the National Center is working in your region, and you can access the services of that person. And also the materials, where we do already have lots and lots of materials regarding the healthcare challenge process, some papers that have been done by national organizations with strategies, and as I indicated, as we're kind of developing this knowledge, we're going to be using all of the National Center forums to be able to communicate it to those communities who are not directly involved in the healthcare challenge grants. Carolyn?
And I would say, since I wasn't at the beginning of this, I will mention that I was just on a webinar related to the new workforce legislation, the Workforce Opportunity and Innovation Act, and what I would say, if you haven't gotten started on mobility management, is to reach out and have conversations in your community. Because a lot of times mobility management, it's going to take partnerships, and so you want to first be able to identify where some really pressing issues are that need a different type of solution. So transit routes may have worked for decades, but things have shifted. People's needs have shifted. So that's where mobility management comes in, because it says no wrong partner, no wrong solution, no wrong service. And so I would just say, to get started, is go and see what your partner's needs are. What's the housing authority's needs? What's the community-based organization's needs? And then get started from there. And we find that mobility management approaches work very well around healthcare needs and job access needs and some other sorts of needs. In terms of Rights to Wellness and a mobility management approach, if you're not on the healthcare side, I would reach out and go talk with discharge planners, or go talk to your community health center and say, what are some of the needs that you've seen? We know from reviewing the applications for the healthcare grants that we had some of the dialysis providers, they used private providers at the table because they saw a need to come there. So I guess that's what I would say, is where to get started is more like a big picture answer to your question, is see what your community players and what your constituents needs, and then build your mobility management approach around that.
And this is Danielle. I would just add one additional thing. Someone asked what they can do in their community, and I just wanted to give the example out of the state of Missouri is doing a Rights to Wellness event statewide, and there are other smaller areas as well as regional areas. They're holding their own Rights to Wellness event, which is really bringing together all of the healthcare providers, healthy food providers, pharmacies, transportation providers in that area for a half-day meeting to really help bridge the divide. That's just one suggestion.
Great, thank you, everyone. And just a reminder, we will be posting a PDF of these slides, so you'll be able to get the links and the contact information of all the panelists today on the PDF, and then we will post a recording of the slides as well. Can you sign up, Judy and Carolyn, for the listserv on your website on the National Center for Mobility Management.org?
Definitely.
The best way to do that?
You can get the address to do that, but right now our listserv is the LinkedIn one, and if you go to LinkedIn and have an account, you could type in Partnership for Mobility Management, and then you would get into the listserv. But signing up for our newsletter is through our website.
Great. Okay, next question. In relation to summer feeding and making deliveries, I think public transit agencies are prohibited from that type of activity. So I think this would be mostly for Rick, and I can send it to you in chat as well. So are transit agencies prohibited from doing that?
So this is Danielle, and I'll just briefly say that in the Section 5310 circular, it does actually specifically call out the ability to use 5310 funded vehicles for home delivered meals programs, and it has the caveat as long as it does not interfere with regular services. So for example, if the vehicle is not being used, the circular basically is letting you know it would be okay for you to use that van in a partnership to deliver meals. And if anybody needs me to help them find that, you're welcome to contact me through the contact information on the webinar, and I would help you to find that exact wording.
Thanks, Danielle.
Okay. Rick, anything to add? Or?
No, Danielle's given a perfect response there.
Great.
And this is Judy. Can I just add something? I just had a conversation with a DOT person from southern state, and they set up their summer meals program a little opposite. Instead of bringing the meals to the families and to the children, they provided mobility training and orientation to the families and the children so that they could bring them to a congregate meal site. And it was really interesting because they did this in conjunction with the senior program they had. So the seniors and the youth and the families were all interacting. And then at the organization to which the meal was being delivered, they also set up some kind of related community activities. And so the youth were getting, educational, community, recreational experiences in addition to getting a good meal. And it was really an interesting model because they were actually bringing the families and the youth to the setting.
Great. Thank you, Judy. And is Danielle or Rick, is there a way for people to stay up to date on the developments of Rides to Wellness?
Yes. The National Center for Mobility Management is really the best place to look for that. They have a part of their webpage dedicated to the Rides to Wellness, and right now it showcases everything from the summit that kicked off this initiative. And then we also have through unitedweride.gov have information on it. So either of those two sites are a great location to learn more about the initiative.
I'll quickly add to that, Danielle. The unitedweride.gov site is, we hope, very soon to be completely revamped so as to take it kind of out of the 90s. It seems like it's in at the moment. And it will feature very prominently activities related to Rides to Wellness from FTA, but also connecting with all of our other federal partners, as the unitedweride.gov site is really our spotlight for interagency collaboration.
Great. Thanks, everyone. So we don't have any other questions, just last call for questions. And we'll make sure to, like I said, we'll post this information so you can follow up if you don't feel like you got a question answered fully. And yeah, I'm not seeing anything else coming in. So I think we'll just wrap up now. And before we fully close, I would like to just let everyone know that on the page where we'll have the slides and recording of our website, that's at nationalrtap.org on the webinars page. We also have all the slides and recordings from our previous webinars. Some of the previous topics are on the screen. And future topics include the FTA bus safety program and Title VI programs, and other topics. If you have a suggestion, get in touch with us by email or phone or chat. So stay tuned for those. And with that, I just want to thank all of our presenters. It was a great presentation. I hope it was helpful for everyone. And we want to thank all of you for joining us today, and hope to see you at our next webinar. So take care. Thank you.
you.
Bye.
Thank you.
Thanks, Elizabeth.